Hey everybody, welcome to Fertility Fact or Fiction. This is our show every week where we are happy to join you guys and answer all your questions about all things fertility related. We are going to be going through a quick topic tonight on testosterone priming and an interesting article that is just in the proof stage right now, so it hasn't been published yet, but it will be coming out soon. Yeah, so we've got a great topic for tonight, and then we'll answer all your questions live as we always do. Some people are putting their questions up already, and we're always happy to see that. So we do start first come, first serve, so don't hesitate to put your questions up, and we will happily address all of those. We do have a little bit of a change in our normal parameters. Tarek, unfortunately, is not here with us tonight. Some very, very misguided and malignant human being decided to unfortunately attempt murder on an entire Muslim family in London, Ontario by trying to drive over them. And so Tarek is in that community tonight helping on the social media front and to help get the message of peace out to people in these very, very troubled times. So my heart goes out to you, brother. I know you're doing good work out there. We miss you here, but you're doing something hugely important out there. So thank you for what you do. Hopefully everyone can hear us. I think you should be able to. And there shouldn't be any problems with anything. So we're going to get started. And thank you to Nadine, who is running the show behind the scenes tonight. Albeit from afar. She's not here in the office with me. So the article we're going to look at is a really interesting article. And what they examined was the basically the use of testosterone for priming of the ovaries prior to your stimulation cycle, and whether or not that would increase the number of eggs that you make, and whether or not it would increase your outcomes or improve your outcomes. So this is kind of a hot button topic. There are a lot of people that have looked at this previously. They've checked it in terms of testosterone priming prior to, during, sort of before and during. And there are many studies and many articles out there, but no one definitively has been able to prove one way or another. And so there's quite a bit of question as to what the truth is. So these authors actually looked at kind of an interesting approach to things. They ran a randomized controlled trial in 3 arms. So the first arm received 56 days of testosterone prior to the stimulation. The second study group had 10 days of testosterone prior to the stimulation. So they had a long course and a short course. And then the third group had nothing. They didn't get any testosterone. Now there wasn't a placebo group. So this isn't the ideal study because you didn't know which group was which. In a perfect study, everybody would have gotten the same thing for the same duration of time, but they would have had one group getting the testosterone the whole time, one group getting placebo until 10 days before and then getting the testosterone, and one group getting placebo the whole time. So it's not a perfect study, but it's reasonable. The numbers are very small. They had 17 in the long group, 16 in the short group, and 16 in the group that had the control with no testosterone at all. So they had very special criteria. The patients all had to be poor responders, meeting the Bologna criteria. So they said that you had to have at least 2 of the following: either a previous episode of a poor ovarian response with 3 or less eggs in a conventional stimulation protocol, advanced maternal age, meaning 40 years or more, according to this study, or any other factor for poor ovarian reserve, such as ovarian endometriomas, previous ovarian surgery, and previous exposure to gonadotropic drugs like chemotherapy, or at least 1 abnormal test, which was an antral follicle count less than 7, or an AMH less than 7.9. So these are the criteria they used. You had to have those to be included in the study. What got you excluded? Any kind of non-corrected uterine problem, any type of endometrial pathology, severe male factor, which they defined as a sperm count less than 1 million, hydrosalpinx, complete premature ovarian failure, BMI over 35, or previous androgen treatment within the last 3 months. So pretty tight criteria. This is a really uniform group. The other thing that's interesting about this study is they made no dose adjustments to their IVF. Everybody got 300 units. They are all on it for as long as they needed to get to having one follicle that was 16 millimeters in diameter. They triggered them. They did the retrievals at the same time, and then they compared the results. So it's a pretty tight study in terms of the methodology. It's not ideal in terms of the actual structure at the beginning where they were comparing the groups, but it's a reasonable study for what they've done. So their results are quite interesting. They had absolutely no difference in any of the outcomes whatsoever. So when they looked at the total number of eggs that they retrieved, it was 3.5 in the long testosterone group, 4.1 in the short testosterone group, and 3.8 in the control group. And there was no statistically significant difference between those. When they looked at the number of mature eggs, 2.2 in the long group, 2.7 in the short group, 2.9 in the control group. So again, not statistically significant. There were no differences when they analyzed that. They looked at how long you stimmed for. Even that wasn't very different. 10.25 days in the long group, 9.82 in the short group. And they also looked at the control group, and there was only 10.3. So, sorry, 10.4. So no real difference there. The next thing they looked at was how many patients made it to an embryo transfer. So interestingly, 41% in the long testosterone group made it to an embryo transfer, 56.25% in the short group, and 50% in the control group. So again, no statistically significant difference. But the good news is they made it to an embryo transfer. The downside, these were all fresh, and they were doing day 3 embryo transfers. It's not particularly hard to get to day 3 with diminished ovarian reserve, but it is hard to get to day 5 or day 6 blastocysts with diminished ovarian reserve. So we don't know if these embryos were genetically normal. We don't know if they resulted in an ongoing pregnancy for a long time. They did have data on that later, and I'll share that with you in a moment. So they looked at the number of embryos available for transfer, 1.4 in the long group, 1.27 in the short group, 1.44 in the control group. So again, no statistically significant differences. They had a 17.6% pregnancy rate in the long group, so very, very low. They had 0% in the short group, and they had 12.5% in the control group. And again, that's not statistically significantly different. Now it looks different because you've got 17 versus 12, but when they actually analyze this statistically, it is not any different. And then they did look at the ongoing pregnancy beyond 12 weeks. And they said that 3 pregnancies, which were the 3 that got pregnant in the long group, all stayed pregnant beyond 12 weeks. And the 2 that got pregnant in the control group also got pregnant and stayed pregnant beyond 12 weeks. So essentially what they said is testosterone priming doesn't work. But the truth is, this is a very variable study. And this is one of the ones I wanted to highlight for you guys because, you know, studies are all based on what we get as results. And I was talking to a resident working with me today about the results from a study on cervical length and preterm labor. And the reality is that it's, you know, only as good as the study material and the study sort of control and the structure that you have. And that's the value of that data is based on how good those results are and how good that structure is and the design of the study. So in this study, they missed the mark in several areas. Number one, they did not have a properly randomized controlled double-blinded trial because there's no placebo. Number two, they did not continue the testosterone into the stimulation, which arguably is the point at which you need it the most. So there are studies that have shown that if you use the testosterone during the stim, it not only improves the number of eggs that you get, it actually improves your live birth rate. And that's one of the reasons we use the testosterone priming through our stim. So we started a little bit before and we continue it through our stim phase until we're done. So this study missed that because they stopped the stimulation ahead of time, and therefore they're not getting quite the same results that we would like to get. So it wasn't a perfect study, but it's a reasonable study. And, you know, we want to kind of look at that and see what the chances are going to be. So how do we do that? We actually would need another study. We would need them to go back to the drawing board and say, let's do it with a randomized controlled trial, double blinded to both, and then determine on application, which we would certainly recommend should be until you trigger, and then grow them out to day 5, check to make sure those embryos are genetically normal, because we do know that the patients that have diminished ovarian reserve have a higher chance of aneuploid embryos. And then once you know what you've got, you can sit down and say, okay, now we've got like a real valid study. Let's look if we're getting a better outcome. So is it a fact or a fiction that testosterone priming can be beneficial? Actually, we don't know. It's neither a fact nor a fiction. The studies out there that show that you do it through the stim support the idea that it can improve the success. This study says it doesn't, but it's a very small study. There aren't a lot of patients in it, and it wasn't a great structure. So it's really important when you're looking at the research out there or analyzing studies to understand exactly what the structure was, understand exactly what the methodology was, who were the patients, what was the population like. You can't just take these and say, oh, this study showed this, therefore everybody should be doing it. It doesn't work that way, guys. So I hope you enjoyed that part of the show. Make sure you like, comment, and share. And we're going to go right into our questions now. So I'm going to run through all of these questions, and I think some of them have gone through. Okay, so how long before trying to convince, I think that means conceive, as a man, should we discontinue taking medications that can potentially damage the process of making your wife pregnant? Same with diet, lifestyle, bad habits. Okay, so number one, don't have bad habits. Those are bad. That's why they're bad habits. So I would stop that as soon as humanly possible. Number two is at least 3 months is the answer to your question, because the sperm that we as men start producing today comes out of us roughly 2.5 to 3 months from now. So you want at least 3 months to get everything out of your system, but never engage in bad habits because that's just bad for your health. Fire ahead, Nadine. You can go to the next one. Is there an increased risk of a chemical pregnancy with IVF, own or donor eggs, than natural pregnancy? If yes, then why? Not that I'm aware of. Having a pregnancy right after an IVF pregnancy has been studied, and there's no increased risk of loss or miscarriage. In fact, they've looked at natural pregnancies and if it's okay to get pregnant immediately after a previous loss. And there's absolutely no difference in the outcomes if you get pregnant right after or you delay several months. So we no longer tell people to delay several months. We tell them to go on right ahead and get pregnant whenever they want to. Yeah. Is fibroid hurt kidney? I have fibroids, and recently I had to go to emergency and they said I have kidney infection, a high fever. You would have to have an absolutely massive fibroid that is occluding your ureter, which is the tube that connects your kidney to your bladder. And then if it was leaning on that or pushing on that, backing up the urine, yes. But that would have to be huge and in a very awkward place. I have seen it happen before, but it's not very common at all. I'm going to take an Instagram question. So give me a second there, Nadine. Let's see what they asked us on Instagram here. What's the average number of IVF cycles people go through before they have some success? So that's a question from Adam. So Adam, great question. And the answer is it's entirely dependent on the quality of the sperm and the quality of the eggs and the number of eggs. So a lot of it has to do with the woman's ovarian reserve. I would say with us, our average number is 1 because we tend to be pretty successful, but we have couples that need to try more than once. And if you're getting older in your reproductive years, Sometimes you need many tries. If you watch our video on YouTube called Embryo Math, it will answer that question for you, because I did the math to tell people how many cycles or how many tries they need to achieve a successful outcome. So, if you're 35, you may only need one. If you're 40, you may need 2 or 3. If you're 43, you may need 3 or 4 cycles to achieve one successful pregnancy. So it all depends on how old you are, how many eggs your partner can make, what your sperm quality is like. I'll take one more from here. Hang on one second. Hi, Dr. Victory. What are your success rates for someone with a BMI higher than 40? Does transferring 2 embryos increase chances? Can you implant 2? Okay, so we desperately try to avoid doing IVF in patients with a BMI over 40, because the studies show very clearly that the chances drastically decrease. So unless your age is a very significant factor, the key is to actually lose the weight first before doing the IVF. So we hesitate very strongly. Why? Because it's up to an 80% decrease in success. Miscarriage rates are higher. Complication rates are higher. Pregnancy complication rates are much, much higher, including disastrous things like preterm labor, bleeding, stillbirth, diabetes, high blood pressure. So we try very hard to get our patients to get into the best shape they can be before they start. The other part of that is, can we put in 2 embryos? Yes, of course we can. We try to avoid it where possible, but we can. And in some circumstances, it's reasonable to do so. Does it increase chances? It depends on who you ask. So there are studies that show that if you do lots of individual embryo transfers, you actually have a higher success rate than if you do all of them in pairs of 2s. So we think that single is better, but it all depends on what you're aiming for. Nadine, fire away. Hi, Dr. Victory. I've been taking melatonin for several months prior to my supposed IVF date for better egg quality. I am 6 weeks pregnant. Yes, it's totally safe to continue on melatonin. Also, is it okay to go in a lake or pool during the first trimester? Yeah, it's totally safe to go in a lake or a pool during the first trimester. Enjoy yourself. Just don't be diving or, trying water sports like tubing or something like that. But anything gentle, a swim, anything like that is fine. Hi, Dr. V. I just want to give a shout out to Nurse Kasia for being so kind and supportive to us today. VRC has the best staff ever. Thank you, Hanlu. Kasia is a relatively new hire, and I thank my lucky stars every day that we managed to snag her. She is absolutely spectacular, and we love her. She is a really, really amazing, super bright, super talented lady. And I owe a huge debt of gratitude to my existing team for finding her and convincing her to come here. So God bless you, Kasia. I love you. You're amazing, and VRC would not be the same without you. So thank you, and thank you to Lisa and Mara who told me to hire her. So you guys are awesome too. Love you. Next. Is poor sperm quality used for IVF less likely to fertilize an egg? Yes, of course. If the eggs are successfully fertilized with ICSI, does sperm quality affect the embryo's ability to make it to day 5? Yes, it does. For sure it does. Yeah. I'll take an Instagram question. Is there a difference between day 5 and day 7 embryos? Yeah, so I was just talking with an American patient about this. She was contacting me from Pennsylvania. So day 7 has a much, much lower success rate. It's about 15% successful compared to usually 50 or 60 with a day 5 or a day 6. So there's a huge difference between a day 5 and a day 7. Hello, Dr. Victory. Is it safe to get dental work with local anesthetic? If you're already pregnant and you're getting dental work, there can be a sudden influx of bacteria from your mouth into your bloodstream if they're digging around in your roots and so on, or in your gums. So that has been associated with preterm labor. It's one of those weird, obscure things that I come across, but it does happen. So lots of antibiotics. You can't really sterilize the mouth. So just lots of antibiotics, and be very careful. But if you can avoid doing a dental procedure where they're digging into vascular areas in your mouth, you should. I mean, fill a cavity, floss your teeth, clean, whatever, that's fine. But anything where they're really digging around is not a great idea. Having said that, you do have to protect your teeth too, so that's important. Okay, Nadine, back to you. The best doctor. Wish I could be there by your side. From Tarek Ibrahim, a total stranger to the show. Tarek, we love you, buddy. I don't know if you were watching earlier, but thank you for everything you're doing. And our hearts go out to the family that you're taking care of out there. I can't even imagine that grief. Hopefully we can all say a prayer for that family. They need it. And for everyone's sake, we need to make a better world where we actually love one another, respect one another, and genuinely show up every day wanting to make other people's lives better. That's why I do what I do. That's why Tarek helps me do it. That's what my family is all about. We are all about helping people. So hurting people is the farthest thing from my mind ever. I can't imagine what would bring someone to do that. Has there been any credible research on an antihistamine protocol for RPL? No, I've looked for it. There's no credible research. As well, for women with hypothyroidism, is it ideal for TSH to be 1.5 to prevent miscarriage, just less than 2.5, and keep your antibodies as low as possible? So you want your T4 in the normal range, so sort of like an 11 to 17, 18, not too high, not too low. And you want your TSH less than 2.5. You want your antibodies negligible. Good question, Kayla. I'm 40 on my third round of IVF, AMH 9. Round 1 meds were off, and I only got 1 blast. Oh, I'm sorry. Round 2 started with 15 eggs and ended up with 2 blasts. Did PGT on all 3, only 1 euploid. Continued. Nadine, you got to click the rest. Implantation failed. This round doing Lupron to prepare, then going left. Lupron 0.5. I have 18 follicles so far. That's awesome. They are doing fresh transfer this time. Day 8 is Thursday. You have 18 follicles. Cindy, it depends on how well they're growing. Make sure that they trigger your release when you have not gone more than 11 or maximum of 12 days. Don't wait for tons of eggs. Tons of eggs does not mean better results. It means worse egg quality. So you want to trigger earlier so that you can get good egg quality out of your cycle, not later so that it's taking a lot longer to get the eggs out, because those will be poor quality eggs, even if you have more. I don't use Luveris. I love Serono, great company. I got nothing against them. We use Gonal-f in every single study, in every single case, because it's an amazing product. But there is a study that shows that you are better off using a half-half ratio of recombinant, which is Gonal-f, with urinary. So we use Menopur. Luveris is also recombinant, but that's just my opinion. I did it based on the research, but that's why we do what we do. Let me jump to Instagram again, Nadine. How important is the embryo grade on non-tested embryos? Yeah, so we actually reviewed that a couple of months ago on the show. Embryo grading is reasonably important once you get into the really poor quality embryo grades, but between like a BB and an AA, there isn't really much of a difference. But once you get into the Cs, you start to get kind of compromised in terms of the results there. Age 31, did IVF, 26 eggs fertilized. Wow. Ended up with 10 embryos, male factor, poor morphology, and high DNA fragmentation. That was the, I don't know what that was. Oh, the day 5 and the day 7 embryo patient. Yeah, well, if you've got day 5s, use your day 5s, leave your day 7s till the end. And if you have high DNA fragmentation, there are techniques you can use to improve that. So get them off of everything bad. No smoking, no drinking, no drug use. I mean, none, zero, none of those. Loads of vitamins, keep the testicles cool, ejaculate every 2 days. And then on top of that, you can very easily improve sperm DNA fragmentation, either by using Zymo, if you've got the Zymo device at your clinic, which is a micropore filter for sperm, or just have them ejaculate 3 hours after the first ejaculation, the second sample has way better sperm DNA fragmentation. That's been proven in a really simple, elegant study. So that's what we do. We just get our guys to ejaculate a second time, and the results are amazing. We have great outcomes with that. I'll take one more. Would I suggest PGS testing? Not if you're young. You're 31, so you don't need it. Hello, Dr. Victory. Is it safe to get dental work? Oh, you just asked that, so I've answered that. Just starting IVF. I have diminished ovarian reserve and only have 4 follicles. I am on Decapeptyl, Omnitrope, Recovel, and Menopur. Wondering if we still have decent odds or if we realistically don't. Brianne, it depends on your age and the quality of the sperm. Everyone's got a chance. With 4 follicles, it's relatively difficult, but depending on your age, it might work out. It's always worth 1 or 2 tries if you can afford it. If you can't, that's a different story. But if you can afford it or you have insurance, definitely go ahead and try. There's no reason why you can't. Absolutely. Fire away, Nadine. Is it true that kids born with assisted reproductive technology have slightly worse metabolic health later in life? If they are compromised in the pregnancy with intrauterine growth restriction, hypertensive moms, obese parents, yes. But in the absence of that, if it's a normal pregnancy, no. And that's been very carefully studied. Next. Had my egg retrieval Sunday, 13 retrieved, 10 mature, 7 fertilized. Poor sperm quality due to male factor cancer treatment, even with poor quality sperm. Is it likely many of the 7 will get to blast? Yeah, if you have 7, well, it depends on your lab. So my embryologist day after day keeps giving us 100% blastulation. So she'll fertilize like 16 eggs, and then she goes, look, I got 16 blastocysts on day 5 or day 6. So she is the best I've ever seen. She's incredible. My previous embryologist used to tell us he was the best in the world. Not even close. I mean, she is magnificent in every way. So incredible, incredible results. If your lab's amazing, you've got a great embryologist, you'll have good results. On average, most people will get 50% if you look at studies, because it ranges anywhere from a low of 30 to a high of 70. But realistically, you can easily expect 50%. So you should get at least 3 or 4 of those to reach blast. Yeah. Good timing, Nadine. Dr. Victory, can you take baths if pregnant? Yes. If water temperature matters, it does. And also, is it safe to take hydroxychloroquine for arthritis? And what's safe to take for acid reflux? Wow, Liz, you got 100 questions. Okay, can you take baths? Yes, but if they're the baths my wife takes where she comes out looking like a lobster every night, no, because when you get that hot, your blood comes to your skin surface to cool, and then you don't have as much circulating. So A, the baby gets less, and B, whoops, your brain and heart get less. And as a result of that, what ends up happening is that you pass out when you go to get up. Passing out in a wet bathtub or bathroom is a very bad idea. So don't take a piping hot bath, take a reasonable bath. And as well, make sure someone's there when you go to get out, and get out relatively slowly. Flex your quad muscles back and forth, like by kind of squeezing your butt cheek, and that'll make you not pass out. Hydroxychloroquine is fine in pregnancy. In fact, lots of people use it for the immune protocols. Acid reflux, either ranitidine or pantoprazole, they're both fine. I'll take some Instagram. I am 32. That was Brianne. You have the best office manager. I do have the best office manager. That is very true. Thank you, son. Mara is amazing. Given that the second COVID shot appears to cause more of an immune reaction on people, should you wait to do your FET after you get your second shot? I know you have mentioned waiting after the first. No, so Missy, actually the second shot normally does not have that much of an immune response. If you look at your antibody titer, it actually only rises a little bit after the second shot compared to the first. So I'm not sure what you're referencing there, unless it's something I'm not aware of. So no, we don't recommend waiting that long after the first. I wouldn't do it within a week or two, or a week, I guess, but after that you should be fine. It's not a problem. Is it true that the first FET, that if the first FET is successful, that the second FET a couple of years later will also be likely to be successful? No. It's all totally dependent on you and her and the sperm and the embryo. There is no rhyme or reason to this. It is true that if you've previously been pregnant with or without assisted reproductive technology, that it is easier to get pregnant again, but not necessarily immediately with the first embryo transfer. Fit Farm D, oh, I love you. Hello, my Michigan friend. Are there cases where you continue Lovinox throughout pregnancy? Half of the cases we do, we continue Lovinox throughout the pregnancy. So if we've got someone on Lovinox for an immune protocol or because of a thrombophilia, I keep them on it the whole time. Great question. We don't stop. We keep it going the whole time. Yeah. Fire away. Nadine, that's you. Yes, it's totally safe to take Benadryl for allergies while trying to conceive. You can take as much Benadryl as you want. Have at her. Hi, Dr. V. We had our first consult with you this afternoon. You gave us a 20% chance of success with IVF. I've been very sad all afternoon. Oh, I'm sorry. Go ahead. Wanted to know, how many rounds is the max you do? Not that it's an option financially, but I'd like to know. Okay, so first of all, I don't want to make anybody sad, but I also don't want to lie to people. So when I expressed to you your chances, that was a realistic appraisal just based on the math. That doesn't mean you shouldn't try, and I'm 100% supportive of trying. But I do like people to understand what they're getting, because I find that the greatest failure of fertility centers is that we don't advise people properly. The reason I did the embryo math video on YouTube is because an Israeli study showed that women that went into a fertility center who were admittedly a bit older and were told that they had a 5% chance of success, wrote down as part of a questionnaire afterwards that they thought that their chances of success were actually 50%, 49.3%. So they were told 5, and what they're actually hearing is 49.3. So I don't want people to turn around and say, you said this would work, when I didn't say that, and I want to be very realistic with people. How many cycles of IVF is reasonable? It depends on the outcomes that you're getting. So if you've done 2 cycles and you made plenty of eggs and all of your embryos were genetically abnormal, I mean, probably that's a good indication it's not going to work. Likewise, if you only made 1 egg each time and they were both abnormal, same problem. It's likely not going to work. But if you made, a couple of embryos, 1 or 2 were genetically normal, you did the same thing again, you get 1 or 2 genetically normal. I normally would tell people a maximum of 3. You need to twist my arm to get me to do more than 3 cycles of IVF in someone. I need a very, very good justification for that. I've done it very rarely, very, very rarely. And most of the time it was because the patient actually had previously, during one of the other cycles, gotten pregnant and then miscarried or something along those lines. So hopefully that answers your question. Maximum of 3. For PISA sample, is there any difference for frozen and fresh sperm? Yeah, it's better to probably have fresh PISA than frozen. I mean, you're already pulling it out of the epididymis. To then go and freeze it and then thaw it and then use it is not ideal. However, it's very difficult to coordinate getting a fresh PISA and an egg retrieval at the same time. And you have to have a frozen backup just in case. Because if you don't get any sperm, you're screwed. And now you've got eggs in it, you have to freeze the eggs, and nothing is worse than freezing the eggs. I'll do some IG. Does low-dose Accutane, 20 milligrams a day, affect male fertility? There is some evidence that it might. There are some studies that have said that Accutane can alter sperm performance. So I would get off of Accutane if you're trying to get pregnant. Advice on next steps after 3rd miscarriage. Miscarriage unexplained. All tests came back good. Make sure you're seeing a fertility specialist that is a true expert in recurrent pregnancy loss, because most of the fertility specialists don't even know what to do for recurrent pregnancy loss. So there's a whole panel of testing that needs to be done. Make sure you do the entire panel of testing, including Fertility menstrual blood testing to look for infections. I just had a patient the other day I spoke with. She got pregnant from her IVF cycle, miscarried, totally unexplained, no reason why. She was perfect in every way. We ran the fertility test and she had 4 separate infections that I need to treat. So that's critical to your success. Will receiving a COVID-19 vaccine affect pregnancy? Okay, so I am working on our COVID-19 video. It will be ready very soon for the 5 biggest lies in regards to COVID vaccine and pregnancy or fertility. It absolutely is biologically impossible for the COVID vaccine to affect a pregnancy. If you get a raging fever, yes, that could increase your risk of miscarriage. It has nothing to do with the vaccine. It has to do with your body's immune response to the vaccine. The vaccine itself biologically cannot do any of the things that people claim it's doing. It's all absolute BS, not a speck of truth to any of it. One more quick one. When is the first ultrasound after confirmed pregnancy? When you're roughly 6 weeks, because that's when we can start seeing the heartbeat on the baby. Okay, Nadine, fire away. Krista, that's a great question. Hi, Krista. I hope you're doing well. There are loads of things you can take. So you can take vitamins, in particular vitamin D, coenzyme Q10, melatonin, fish oils. Any antioxidant vitamins will help. You can try taking things like testosterone priming, which we talked about at the start of this show, and or DHEA, which some people believe works. I think I said coenzyme Q10, but definitely take coenzyme Q10. Some people suggest traditional Chinese medicine or acupuncture. That may also be helpful. If you have other reasons for it, for example, if some people have endometriosis, there are medications you can take prior to, like Bizan, if you can get access to it. If not, then wait until after you've made your embryos, and then freeze them and do Lupron and Letrozole for 3 months. Prior to your embryo transfer, and that'll help as well. Yeah. Hi, Dr. V. You've previously mentioned basal body temperature is unhelpful for TTC. Do you think something like temp drop that takes your temp all night instead of one temp? I can think of nothing that would drive anybody more crazy than sticking a vaginal probe inside them and constantly checking some kind of monitor to tell you what your temperature is. Basal body temperature monitoring is useless, guys. An LH kit where you pee on a stick once a day, every day, has like a 98.3% accuracy. There's nothing you're getting out of basal body temperature other than frustration for you and your partner. Abandon it or drop it like it's hot, I guess is the right term. So yeah, it's useless. Don't bother with basal body temperature monitoring. Good question though. How long before trying to get pregnant as a girl should she discontinue smoking and taking medications that can potentially damage the process? Same with diet. So Stoyan, you asked this of the guys before. Girls should never smoke. No one should smoke. Guys, girls, you know, doesn't matter what your sexual orientation is or what you identify as. Don't smoke is absolutely wretched for you. Don't vape, don't smoke, don't chew, don't get near any kind of tobacco product. Also, don't use marijuana. It's the same thing. Diet, months and months and months in advance for women. Yeah, it takes a long time because washing stuff out of your system as a woman is difficult. We make new sperm every day. Women have all the eggs they were ever born with. If you've exposed them to toxins, it is bloody awful difficult to get it out of there. Good question. I'm using donor sperm. After 2 rounds of IVF and 1 euploid failed frozen embryo transfer, my doctor suggested, among other tweaks, I changed the donor in case they were causing an issue. How is that? I mean, it's possible. I would need to go back and look at your file, Cindy, to figure out exactly what was happening. But it depends on what exactly was sort of responsible. It can be the sperm. Some donor sperm cases are not good cases. So they're the ones where you want to change. I'll do some IG. When is the first, oh, I did that one. Is Canada in Canada, is compensation available for egg donors? Phoebe, no. it is not available. Sorry. Is needing stims for 13 days a bad sign for IVF success? 38 years old, no growth of follicles above 1 centimeter for 6 days. Now, day 12 with 11 good size. Trigger tomorrow. Day 13 has been shown to decrease success. So you're on the fringe. Up to day 11 is good. Day 12 is okay. Day 13, you start taking a notch down. So get them triggered and get them out as quick as you can. Is it safe to continue use of progesterone suppositories throughout the entire pregnancy? Totally. I'm 32 weeks and still taking 1 pill 3 times a day. I insist on it. So yes. Fit for MD again. Is it common for a patient to have recurrent migraines in first trimester? Yes. Is it due to increasing hormones? Probably estrogen. Does it get better in the second trimester? Most of the time, yes, because your estrogen level stops fluctuating, but not always. We do get a lot of women with migraines in pregnancy where it's just ongoing bothersome. I typically send them to neurologists just because I don't want to take any chances with anybody's head. So we'll send them to get checked on. Okay, fire away. It's kind of fun. I like this. This is good. Hi, Dr. V. How many months should anyone wait after their failed IVF to go for another one? You don't actually need to wait. You can try as soon as you want to. Sometimes we go back to back. Sometimes we'll give people a month in between. It's your stress level that's probably more important than anything medical. So if you're worried, then, take some time, get your mind right, your soul right, your, psychology right. If you're raring to go and excited to try again, try again. There's no need to wait. My age is 35. I tried 4 times conventional. All are failed. I'm so sorry. I have low ovarian reserve problem. Now I am trying mini IVF. Do I think I have a chance to get pregnant? There's always a chance. Mini IVF is not going to solve the problem when conventional didn't work. If you've done 4 tries and the low ovarian reserve is the problem, I would actually go straight to doing natural cycle IVF, not even mini. Just get 1 embryo and see what kind of quality you get. If with no drugs, you're not getting a good embryo, then some drugs is not going to help you. So it'll save you money. It'll save you time. Just try a natural cycle IVF cycle. That's what we do. If that doesn't work, you need a donor. And I'm so sorry for your difficulty. That's terrible. Yeah. Hi, Dr. V. This may be off topic, but is a luteal phase of 7 days concerning within 3 months of discontinuing birth control? And what is the usual time frame of cycles of ovulation to return to normal? 3 months, and 7 days would definitely be short, but I'd give it a couple of months before I'd be worried about that. So if you're still like that 2 or 3 months from now, come and let us do your hormone spread. What can be done for unresponsive ovary? Can it respond on another IVF cycle? Yes and no. So there are patients where they have ovarian resistance because they have FSH receptor mutations. Those ones you have to do in vitro maturation on. There is no way to get them to stimulate. For everybody else, sometimes it's a matter of finding the right protocol. So we got to play with it till we get the right protocol. I'll do a couple from IG. I have still hands on everything. I have normal testosterone levels, but low free T because of high SHBG. Any thoughts? How long after varicocectomy my testosterone levels should rise? They might not. You may need HCG. Usually the best sperm we see is about 3 months, 4 months after your varicocectomy, and then it starts declining again. So you have a narrow window, start freezing sperm. Is an FSH of 9.4 too high for a 36-year-old? No, it's totally normal for anyone, so you're fine there. Thanks for answering the question earlier. Is it okay also get anesthesia for dental work? Yeah, it's probably okay, although that's not ideal. So I'd delay your FET if you're getting anesthesia to be put to sleep. Good response to Gonal F100 on several IUIs. Now after 300 and Luveris for IVF didn't respond well. Could the 10 days of OCP cause this to happen? Yes, it could have. You don't always need to do birth control. If your ovaries are weaker, or you're over the age of 38, 39, we try to avoid it when we can. What is an ideal sperm count for IUI post-wash? Depending on which of the two studies you believe in that we reviewed recently, anywhere from 9 to 14 million. And then there's a new study coming out which actually says you need at least 50 million progressive motile sperm in order to have a reasonable outcome within 5 years. So it's always interesting to see how these studies vary from time to time. Fire ahead. Nadine. My egg count is very low. Any suggestions to improve egg count and quality? So we kind of touched on that earlier in the show. Vitamins, healthy living, diet, get rid of all the bad stuff, no smoking, no drinking, no drug use, Mediterranean diet, exercise, low stress, lose weight if weight is an issue, gain weight if you're too thin. All of those can help, but it's really difficult to make you make more eggs. It just doesn't exist. That's not something we can do. Excuse me. Hi, Dr. Victory. This may be off top. Oh, we did that one. We did that one too. Maybe those are it. No, we've got some other ones up there I can see. Stoyan asked that both on Instagram and there. Yeah, I've already answered that. It does. It looks like it does. Okay, my question is, I have couples that are wanting me to be a surrogate. Great. I am 7 months postpartum and still nursing, so it would not be till next year at some point. If I was to start the process, would I have to stop breastfeeding? At some point, yes, and definitely before you start doing your transfer prep, you have to, yeah. Because your prolactin levels will be high. It's hard to get your endometrium to thicken. Oh, hey, Mel, how are you? I think we've got a meeting coming up soon. Mel runs a cool service in London called the London Fertility Concierge. So if any of you are from that neck of the woods and want that extra level of TLC, reach out to Mel. She runs a private service and she will help you through your journey. And she's pretty cool. I've had one talk with her on the phone and we're hoping to meet with her soon and see how we can integrate her into our practice. Yep. If you become pregnant or are on some meds, should you keep taking them till you have the blood work done? Sarah, that depends on what meds. I can't answer that without knowing what you're on, but probably stay on them in most circumstances, unless they're dangerous in pregnancy. Why I always see correlation between testosterone levels and sperm parameters. Does this mean that if we raise our T level as much as we can, we have higher chance? So the same signal your brain sends to help you make sperm helps you make testosterone. So if you have a good testosterone response, it means your testicle is working well, which means you'll produce lots of sperm as well. If you take testosterone, your testosterone levels will go up, but you will annihilate your sperm production. So it depends on what you're looking for exactly. Does PRP injection help for low ovarian reserve? There is one and only one study to date which has demonstrated that it might be beneficial. How low is might? They had an 8% success rate when injecting PRP into the ovary. So arguably, you would have gotten 8% if you just tried. Again, that's a super low rate. It's hard to know. We don't know yet. The proper trial has not been done. Hey, Dr. V, are you taking new patients? I am very much taking new patients. That's what we do all day long. If so, I'm 39, I have tubes tied, and had to try 2 IVF. One was ectopic and second was chemical. Well, you have the option of reversing your tubes if that's the only problem. Not sure why you had 1 ectopic and 2 chemical. How'd you get an ectopic with tied tubes in IVF? That's unusual. Happy to help you out. Yeah, just reach out to us and we will be more than happy to do the right thing for you. And sometimes it's just reversing your tubes. If that's possible, we don't insist on everybody doing IVF. Sometimes it's IVF. It depends on what the rest of the story looks like. Melatonin, warm milk, bananas are the natural way to achieve that. We do not recommend taking gobs of stuff that is not healthy for you, including antidepressants or anxiolytics or Valium or anything like that. Any of that stuff can have an impact, both pituitary and hormonal. So not a great idea. I'll do a couple from IG. Can you do anything to prevent a short cervix? How does this happen? Well, if you've had surgery on your cervix, like a LEEP or a cone, that can do it. If you have multiples in there, that definitely can do it. So we're careful about it, but you need to be cautious and thoughtful and monitoring it if you're at risk. So we do monitor our patients that are at risk, and I actually torture them by putting them upside down in a bed for months at a time if their cervix shortens, because when you take pressure off the cervix, it doesn't shorten. So that's our approach to it, but it's just ultrasound monitoring. You can't prevent a short cervix. Just don't strain it, so don't be walking around. And in some cases, a well-done cerclage is important. My colleague, Dr. John Toms, is absolutely phenomenal at doing cerclages, so he does all of ours. What are the odds of the first IUI working? Well, that depends on your age and your sperm quality, so it's impossible to answer. Anywhere from a low of 0 to a high of maybe 25% would be a reasonable estimate. So that's what you should be expecting. So it could be anywhere from terrible to reasonable. Does an arcuate uterus make FET less successful? Not if you believe all the research. They say arcuate doesn't make a difference. Some people say septate does. There was a very recent study which said septate actually doesn't. I don't believe that. I think that's absurd. I don't think that's a well-done study, but that's what they're claiming. So we still remove our septums. If you're very arcuate, we'll still resect those too. Can stress from being harassed and screaming cause a miscarriage right after embryo transfer? Wow. Okay, so that's from one of our viewers on IG. So first of all, please make sure you're safe. I don't like the idea that you were being harassed or someone was screaming at you. So listen, for anybody out there who is being harassed, get in touch with us and we will get you the resources you need to be safe, because I am absolutely worried about you now. So make sure that you have the resources you need. You need your own bank account, your own credit cards. You need your passport and identification kept outside of your home if you're not safe. And yes, stress can impact your success levels, or success rate. So it's important for you to not be at risk and not have stress, for sure. But listen, get in touch with us or your social worker or your friends or your family. Do not be alone if you're at risk. Pregnancy drastically increases the rates of domestic violence. Those guys should all have something done to them that I probably can't say publicly, but listen, if you're at risk, get into a non-risk situation, please. I beg you, be safe. Do you suggest lying down after a transfer and for the next couple of days? Should I be resting mostly? Okay, so no. Do whatever stresses you the least. So if going back to work stresses you the least, go back to work. If lying around and relaxing stresses you the least, then lie around. Do you need to be like, that scene from Mrs. Doubtfire for the rest of the time? No, you don't. That's not going to help you at all. In fact, there are studies that show that being active is beneficial. So that's okay. How can sperm count be increased? No smoking, no drinking, no drug use, cold therapy, vitamins, avoid everything bad, ejaculate every 2 days, eat a healthy diet, lose weight if you're heavy. Okay, Nadine, back to you. We got about 10 more minutes, guys. Hello, doctor. Thank you so much for your time to answer my previous question. One more question. Can sperm morphology be tested from a PISA sample? Yeah, of course. Sperm morphology can be tested on any sperm sample. Thanks for an easy question. For once, somebody gave me a gimme. No, Melissa, if you're getting your shot 2 days after your egg retrieval, there's no issue whatsoever. Go for it. Yeah, that's totally safe. Oh, great. Vane, we will be happy to help you out. Not a problem at all. Oh, perfect. I love our Sarnia office. I love my Windsor office too, ladies, but the Sarnia office is wonderful. The team there is incredible. So they will take very, very good care of you, I promise. Is it safe to paint room? No. I don't even need to read the rest. Get away from paint. Get your family to do it. Get your partner to do it. You don't need to be around the paint. Don't be around paint. It's all sorts of chemicals and it all goes into the air. And you're not going to get rid of it by a mask. So no, don't be painting. Leave it to somebody else to do. Is non-invasive PGTA just as good as PGTA? Which is better? Well, no, it's not. No one has developed technology yet that is as accurate as the trophectoderm biopsy. So the concordance rates are low to okay. Anywhere from terrible, like 20%, up to a high of 70%. So the problem is you won't know if what they're telling you is correct or not. Which one's better? No question. Non-invasive is way better than invasive is, because then we're not poking and prodding your embryo. But the tech's not there yet. We need a better way to do it, where we get more accurate results without having to damage the embryo or biopsy the embryo. Great question. For my other question, the meds I'm on are for PCOS and I have a dental appointment and I have to take amoxicillin. Yes, it's totally fine for you to go to your dental appointment and take amoxicillin. Yeah, no problem at all. Amox is safe. Do you recommend progesterone for everyone after IUI? No, we do it for everybody. We just figure more is better. The data on this is not clear, but we're not taking chances. So we give all of our patients progesterone. Oh, we're done. Okay. Oh, another one popped up. Let me do this one. 26 years old. Hang on, Nadine. 3 consecutive miscarriages, pregnancy loss panel, all came back normal. AMH, thyroid, blood clotting, karyotype, etc. What's next? Fertility, the menstrual blood testing. So check for infections, check for ureaplasma and mycoplasma, check your sperm DNA fragmentation. Those are the main ones. Make sure no one's doing anything bad, no smoking, drinking, drug use. Get your weight down if your weight is high. Hi, Dr. V. What can be done to prepare for FET? Also, is FET done on a certain day in a cycle? So FET is done on a certain day in a cycle if you're natural or programmed to be on a specific day after progesterone. What can be done? There's loads of things that can be done. So there's medications you can use. There's vitamins and supplements you should be on. There's weight control. There's diet control. There's stress reduction. Millions of things you can do. If I'm in Toronto, can you still be my doctor? Absolutely. So I have Toronto practices. I work with Create. I work with my colleagues at Tripod. I work with IVF Canada, although that's dwindling now. Yeah, there's all sorts of options for you. And these days, I mean, I'm working with people all over the world, Japan, Russia, Israel, all of Europe, South America even. So you can reach out to us from anywhere and we can do everything virtually and get your testing done wherever you want. As far as your actual cycle is concerned, I'm happy to manage that anywhere. I frequently just offer people advice to help them in their own journey wherever they are. So the lady I mentioned earlier in the show in Pennsylvania, she's not coming to me. She's just getting my help to guide her through the process with her clinic, which quite frankly was doing a terrible job. So hopefully that'll help her. I have a question. I had an IUI on May 20th and I tested last Thursday. I had a positive test. I tested from Wednesday to Sunday and all came back positive. But today I had the blood test and came back negative. Do you know what can be causing in my body HCG? I don't, but that requires some ultrasounds and it depends on how much HCG they gave you for your trigger, because it can last for some time, especially if you gave it in the wrong place. So that needs to be looked at. Or you got pregnant and then it dwindled off. Maybe it was just a chemical pregnancy. The other possibility is that your test was the urinary kit and it could have been predicting either a prolonged LH problem, for example, if you have PCOS, or it could be predicting poorly because the test is bad. So that's a possibility as well. And I'm done on IG. Nadine, you got some more questions for us there, and then we'll wrap up the show. I am 33 with no significant fertility issue. That's awesome. AMH 17.6, TSH 7.6, started Synthroid a month ago. Left ovary unresponsive at first IVF. Got 7 follicles, 4 eggs. 1 did not fertilize, 2 abnormally fertilized, and 1 blast. Wow. Day 3 transfer and failed cycle. Yep. Keep going. Is there more to that question? Oh, there it is. I've got it here. Husband have both VAS missing due to CFTR. I am not CF. What is our chances? I don't know when you got your thyroid corrected, but that may have been the problem. There is no reason why you would get 7 follicles with an AMH of 17.6 unless somebody did something wrong somewhere. You should reach out to us and we will be happy to help you. There's something very, very odd about that. That doesn't make any sense at all. 17.6, you should have had a much stronger response. Normally that's like 15 to 20 eggs. So something went wrong. Either your AMH is not correct, or it was your thyroid wreaking havoc with things, or maybe they suppressed you before the start. How long after egg retrieval can I start low impact exercise classes? Are 20, 30-minute walks okay to start 2 days out? You can walk anytime you want. That's not a problem. I wouldn't do low impact until your ovaries have shrunken, depending on how big they were and how many eggs you got. Okay, one more question here. Chance of miscarriage at 6 weeks pregnant with PGS embryo, 34 years old. Less than 5% in our program. It should be very, very low. So you should have an excellent outcome with that. Okay, guys, so we're actually out of questions too. That's kind of awesome. Thank you for joining us on the show. Ironically, we managed to finish the questions for once. Normally, we don't finish. Listen, everybody say a prayer for Tarek and the family out in London. Be good to one another. Be good to each other. Be good to your family, your friends, and people you just don't know. That's what the world should be. So have a great night, everybody, and we will see you again next week. I hope that you all stay safe, and for God's sakes, get vaccinated, please. We'll have that video up shortly on fertility and COVID vaccine. Hope you enjoy it, and please bring your friends to our channel, bring your friends to our YouTube channel, and somebody please tell me how to make Instagram actually grow, because I hate Instagram. So have a great night, everybody. Take care. We'll talk to you soon. Bye.